My name is Michael Kerin. I have been diagnosed with necrotizing myositis with the HMGCR antibody. Now, my myositis ordeal began in August of 2020. What was happening was that I started feeling lots of tightness in all of my muscles, all over my body. And I've always been physically active by exercising and playing sports. And at the time, I just thought, well, maybe I'm overdoing it, so let me just rest a bit and let things heal on their own. Well, the days went by and several weeks went by, and the tightness got worse. It started becoming painful, and my mobility started to suddenly decrease. And then by mid-September, I went out for a walk that I do every day, and I was not able to finish it. So at that point, I knew something was wrong, and I probably needed to have some sort of physical checkup. So I went to my primary care physician, and they ran all of the tests with the blood work and everything. And the results came back showing that my AST and ALT levels were very high. And I didn't even know what they were. So he suggested that I see a gastroenterologist. And I did several days later. And nothing turned up with this doctor. But as I described my symptoms to him, he said to me, "This sounds like polymyositis." And I had never heard of this word before, so I just nodded and said, okay. And he referred me to a rheumatologist who I saw several days later. And that rheumatologist, he's Dr. Roman Zuckerman, and he did some more testing, and he came out with the CK level, which is something every myositis patient knows about. And my CK level was over 10,000. And when he told me this, I didn't know what to think of it, and because apparently then he told me that a normal reading is around 150 to 200 for somebody who does not have any issues. So at that point, we knew something was pretty severe or something that needed to be addressed. He put me on, well, actually, he had ran physical tests on me, tested my bones, my muscles, and my legs and my arms and everything, and told me I wasn't the typical myositis patient because I wasn't really showing too many symptoms other than struggling to walk and getting out of a chair and climbing stairs. So he put me on prednisone at that point and said that we would have to go through several weeks of further testing. So as we began these rounds of testing over the course of several weeks, I began to do a lot of research online about myositis, and that is the point where I came across the Myositis Association. Their website was at myositis.org, and there was a wealth of information there that I was able to read up on and learn about. And one of the things I had been looking for too was, once I knew that myositis was probably the diagnosis I was going to get, was that I wanted to find other people who have the disease or who have experience with it, and I wanted to speak with them or just chat with them. And the Myositis Association, they had a community board or a bulletin board, like a chat room, on their site, and I registered and told my story and heard from some people and had varying opinions and kind of discovered that there were so many different variations of myositis, and there are all these different antibodies that you needed to be tested for. So, I mean, it was a wealth of information, but I still wasn't sure about my direction of myositis. So, I was just absorbing so much information, not really being sure of what I could pinpoint. And one of the other things I did at the time, too, was that I opened up a Twitter account that I called Myositis Mike Man. And what I wanted to do there was sort of chronicle my journey, my myositis journey. And what I was thinking was that, maybe this could help somebody else who in the future might come down with the same symptoms I have, and they could see how my progress evolves and how I started out struggling to walk, struggling to get up out of a chair, struggling to climb stairs, And hopefully at that point I was thinking that I would get better and then they could see my progress as well. So we continued on with the testing with Dr. Zuckerman, and I did further research. And also what I found from the Myositis Association website were videos. And the ones that I found were they had held conferences for several years, I guess, on myositis, I guess the myositis industry, and where doctors would come and speak and patients would come and listen, and everybody would get together and just sort of collaborate on what to do and how to handle new treatments and new medicines and whatnot. And it was here where I saw some videos from another doctor who was at the National Institute of Health, and this was Dr. Andrew Mammon. And he had some very interesting videos. And actually, I need to backtrack here. There was a point where Dr. Zuckerman got further test results from the Mayo Clinic, and in one of the tests, they confirmed that I had the HMGCR antibody. So at that point, it was confirmation that I had necrotizing myositis with the HMGCR antibody, and that this was the direction that we were going to go in. So after seeing the videos from Dr. Mammon, there were several that he had done that were catered specifically to patients that were diagnosed with necrotizing myositis and the HMGCR antibody. And in these videos, he had shown that with a treatment called intravenous immunoglobulin, or IVIG, many patients had recovered fairly well after getting several treatments of the IVIG. And when I had seen this was just it was just great news for me to hear, where it just gave me such hope, where I felt that, okay, this is the direction I want to go in, and this is the treatment that I want to get, and I think I will be able to recover like all of these other patients that have recovered with the treatment that he has given to them. So Dr. Zuckerman, who is my local rheumatologist, had also mentioned IVIG to me, and I had told him that was my preferred treatment. But it was a struggle with the insurance company because it's not the primary treatment that a myositis patient would get. Apparently it would be, I think it's methotrexate or something like that. But I had also been suffering from dysphagia, and dysphagia is a weakening of the throat muscles. And what was happening was that I was struggling to eat. Every time I ate, I was gagging my food back up, and it would just take very long for me to grind it down to a level where I could swallow. So he was able to factor the dysphagia into the request for the IVIG treatment, and on the second attempt, it did get approved. And it was funny, where I went to see Dr. Mammon for a second opinion in Bethesda, Maryland, and he actually told me the same things that Dr. Zuckerman had told me, that it was the HMGCR and that the IVI treatment would probably help me. And it was on the way back from the appointment with him where I got an email from Dr. Zuckerman, who told me that the approval for the IVIG finally came through. And this was probably mid-November, so we then had the first treatment scheduled for December 2nd, 1st or 2nd, I think it was. So that was encouraging, and again, this was something where I was glad to hear, and I've been saying all along to myself, I know this is the treatment I want, this is the one I'm going to get, and I know this is going to help me and get me through these troubles that I'm having with walking and climbing stairs and sitting and getting up and everything. So we had the first treatment in December, and it went fairly well. I mean, the only downside to it was I had to take Benadryl, and that kind of made me a little bit woozy and tired, but I mean, I recovered fine the next day. And I think what I had done was probably something that probably wasn't that good for myself. Was I was thinking every day that I woke up and I would get better, maybe this was the day that the IVIG treatment was going to turn things around. But that did not happen right away. And I actually had my second treatment the very last week of December. So we have them scheduled every 4 weeks or so, where I have them on consecutive days every 4 weeks. And then again, I went several days after that treatment thinking, okay, maybe this is the day or this is the day. And it didn't happen, but it wasn't until about the 10th or 11th of January where I suddenly started to loosen up. And I felt that, okay, now my mobility had improved and I was getting up out of a chair with a little bit of less effort. I'm still having to use my arms. And the stairs were getting slightly easier. It was still very difficult, but I was relying on the banister less. And running wasn't even a consideration at that point. So, but then I had my third IVIG treatment, I guess around the end of January or early February. And it was soon after that, or right around that time, where things started to really improve. And that's at the point where I started feeling much better. And I had kept this back from my 93-year-old mother. I tried to hide it from her because I didn't want to bother her with it and get her all stressed out. And then there was one day where she noticed me struggling to go up the stairs. And then I kind of told her, well, look what I can do now. Let me see if I can get up. And that was the first time that I got up out of a chair without using my arms. So that was nice. And then I even got to a point where I was then not needing the banister and climbing stairs. And even, I think by the end of February, I was actually able to run up the stairs, just like a little trot or a jog. And that was such a tremendous improvement for me. And it was just very exciting. Well, now today is March 22nd, and over the last several weeks since my last infusion, I actually don't even think about the myositis anymore. The myositis disease that I have. Yes, it's on my mind, but certainly not as frequently as it was. I am moving around much better. I am climbing stairs. I even actually played a game of pickleball about a week ago. And I just went out just sort of to test myself. And I knew right away that my legs still need work because I don't feel very confident in them. They're much stronger than they were. I would guess that I'm probably maybe 60 to 70% of what I was a year ago. But as I was playing that day, I knew I had limits, and I knew I could not push it to the point that I had used to, or to the point that I used to push it to. But I know that's going to come in time because, my upper body is getting stronger. I exercise all the time. I do treadmill walks. I walk outside. I lift weights. And, I am definitely getting stronger. Now, one other thing I did with the Myositis Association was that I started a fundraiser, and they make it very easy on their website. And when I first came down with myositis, I lost 24 pounds of muscle. So what I wanted to do was start a fundraising campaign where I would donate 10 pounds for every pound I gained back. And now, pre-myositis, I was about 170 pounds. And the day I started this campaign, I was 146. So I called it the Myositis Mike Man 24 campaign, where I was vowing to gain 24 pounds back and get to the point where I was several months ago. Well, what actually happened was I lost 6 more pounds after that. I went down to 140, so it's really the Myositis Mike Man 30 campaign. But today I actually weighed myself in the gym earlier this morning, and I was about 154 pounds. So I am almost halfway there to that goal. I have made the full donation though, but that doesn't mean I'm not going to gain the weight back because I have every intention of doing so. Now, looking ahead, I have every intention of keeping up this program that I've been doing. I am going to continue to exercise. I've been dieting very well too. I've always ate fairly well, but I've probably stepped it up a bit and really limited things that I don't need, and I'm reading labels more and trying to understand them more. But I have every intention of continuing this regimen that I've been doing and gaining those 16 pounds that I want to gain back and to get up to 170 pounds. And I also made what I call a recovery list. And this is a list of activities that I've done in the past that I have every intention of doing again. And those are activities that I have no doubt that I will get to be able to do again. So, I mean, if there's anything I could say or tell to anybody along the lines of encouragement for anybody that has a condition similar to mine, is if you put in your body, put in your mind, put in your diet, put in the effort every day, it's not going to happen overnight. Just commit yourself to it. You will get better. As long as you put in what it takes to do, you will get to the point where I have myself. And I'm very excited about that. And my rheumatologist, Dr. Zuckerman, he actually even said to me in our last meeting was that we're going to continue with the IVIG for now with the same schedule, but down the road we're going to test it to see if maybe I could get treatments less frequently and maybe even eventually get to a point where I don't need it anymore. But that remains to be seen. So, but I will continue to post on my Twitter handle as certain improvements or reportable events, I guess, happen throughout this myositis journey that I'm going through. So in conclusion, I guess I'd like to thank the Myositis Association, my family, my friends, my doctors, and everybody else that has helped me along here. And I mean, this recovery and this fight has only just begun, and I'm expecting to improve greatly over the coming days, weeks, months, and years. Thank you.